Hi, greetings and welcome to Apollo Urlife post-COVID-19 rehabilitation program. Today's topic is exercise as medicine. I am Pariy Thomas and I am clinically certified physiotherapist at Apollo Hospitals, and I work even as a faculty in Apollo College of Physiotherapy. I am thankful to Ms. Upasana Kamineni, Konidela, for giving me this opportunity to share few informations and thoughts with you. And the information given to you today is current at the time of dissemination and is subject to change time to time as science and technology around COVID-19 is changing day to day. Now, coming during my conversation, you can pose your queries so that I can try to answer few or all of them. Now, coming to the topic, exercise as medicine. Doesn't this look unique? Yeah. Exercise has been used as medicine since ancient days. So I would term exercise as a drug. So coming to the term exercise, I would give a term called as generic name to my drug as exercise. The brand name of my exercise would be physiotherapy. There are different brands in the market like Tai Chi, yoga, etc. You can choose your brand whatever you want for post-COVID rehabilitation. But I would recommend my patients to go with physiotherapy after post-COVID-19 so that you will benefit much of it. Yeah. After this brand termed as exercise and physiotherapy, there are many benefits with physiotherapy. You name any system, cardiovascular, respiratory, endocrine system, yeah, you have good benefits with these exercises. And even it's safe for pregnant and lactating women to undergo these exercises. And are there any side effects with these exercises or the brand called physiotherapy? Yes, if not prescribed under a medical professional called as physiotherapist, you may land up with excessive fatigue, excessive sweating, or land up with any muscle injuries. These are the basic side effects. And coming to dosage, yeah, it depends on patient to patient. It depends on the age, and the dosage is prescribed by a physiotherapist, and the time, duration, all this matters. So you should be under a guidance of a physiotherapist for your drug to be administered. Yeah, administration. Administration of this drug can be either self or under the guidance of a medical professional called as physiotherapist. So I'm very proud to say that this is the only drug I prescribe, and this is the only recreational drug in the world, so that you can benefit lots by having your fun and enjoyment during this intake of drug. So let's know something about COVID-19. COVID-19 is an acute respiratory syndrome. This involves many systems in the body, especially lung. So the symptoms of this disease would be cough with sputum, cough without sputum, or fatigue, fever, etc. The mode of transmission of this disease is either by touching contaminated surfaces or through cough with droplet infection or droplets. And 80% of the patients who are affected with COVID-19 are asymptomatic, and 15% are with mild to moderate symptoms, and 5% land with some critical symptoms. So coming with majority of the patients, I would not recommend physiotherapy as exercise for them. So they would just get inflammation of the lung. It's called as pneumonitis. So just taking drugs would be sufficient for it. Mild to moderate and severe cases, patients presenting with symptoms of cough with productive sputum, yes, I do recommend exercise as medicine for them or physiotherapy as exercise for them. So now taking these exercise for the affected part, that's lung, I would term it as chest physiotherapy. Now let's discuss something about chest physiotherapy, the basic topic, the basic medicine or the drug which I'm going to give you today. So I recommend my patients to start with some warming up before you start with the exercises, and then do the exercise part, and then end doing the stretching part. So these exercises might be some strengthening exercises. When you're doing some strengthening exercises, there are some chances that your muscle length gets shortened. So in case you don't do complete warming up and end it up with stretches, you might land up with tightening of your muscles. So the optimal muscle length is decreased. So the correct protocol is to start with some gentle warming ups, do the exercise part, and end it with stretches. Now coming to warming up part, I would recommend my patients just to walk if possible to get little blood supply improved. It's a kind of warming up. And patients who cannot walk, I will teach you one or two exercises to get warming up the part affected, that's mostly your lungs, muscles surrounding the lungs and your rib cage. And you need a stick for this. We call this as a band. You can use this stick as an exercise for warming up. So I would just demonstrate one exercise using this band. Okay, you need to take this stick, just hold it in your hand, stand in a comfortable position, keeping your elbows straight. This can be done even in sitting posture. You have to extend your elbow at the level to the level of your shoulder and above over your head, and hold on for a count of 10, and slowly put it down. During this process, you can inhale your air and simultaneously lift the stick above your head, extending all your hands above your shoulders so that you get a good stretch of your muscles and joints. Your joints around the rib cage. Your joints around the rib cage get mobilized. So you're getting ready, or your joints are getting ready for the exercise part. I'll teach one more warming up exercise. You need to place one hand over the another hand, keeping your hands at the level of your elbow. Bend your forehead and land it on your forearm. Just stretch your spine and hold for a few seconds. And then you can turn to your left, come back to the neutral, and then to the other side. During this process, you can take a deep breath so that again your spine and the joints around your rib cage get mobilized. So you're getting prepared for the exercise part. Now coming up with the exercise part. So there are two things you have to remember the exercise part. First thing is strengthening of your lung. So post-COVID-19 patient mostly lose elasticity property of the lung. To develop this elasticity property, we would recommend you to use a device called a spirometer. The device shown to you is called a spirometer. There are various kinds of spirometers, but I would recommend this kind of spirometer with 3 balls in it. This is a little easier for you to use. So you have to take this. This can be done in 3 postures. One is standing, one is sitting, and one is lying. I would recommend my patients to do in standing, because all the abdominal contents would come down and there won't be any compression of your respiratory muscles. The second best position is to sit and do. Sitting is also the next best position, wherein there is less compression to your respiratory muscles. The last but not the least, lying posture. Even this position, people or old age people who cannot get up can do this. So you need to take the mouthpiece, seal it around your mouth, and inhale air and hold on for a count of 10 or maximum of your capacity so that the ball here rises up. This can be done for a repetition of 10. And for patients with cardiac problems, I would recommend your hold time, that's holding your breath, not more than 2 to 3 seconds. So this spirometer improves the elasticity property of your lung and strengthens your lung tissue. So by doing this, you have completed your strengthening part of your lung. The next important thing is strengthening of your respiratory muscles. Respiration is a process wherein you have inspiration and expiration. Inspiration is an active process wherein your muscles actively function to help you in breathing. So expiration is a passive process. So for the active process, you need to strengthen your muscles. So the prime respiratory muscles are diaphragm and your intercostal muscles. So today I'll be showing you few exercises, strengthening exercises to perform. So I would recommend you to take an elastic band called as TheraBand, like this. This has an elastic property. This will stretch. So there are different kinds of elastic bands in the market with different colors. Each color codes certain amount of resistance. So I have chosen yellow color. Yellow color is the one which has minimal resistance. It would be somewhere between 1 to 1.5 kgs of resistance. So this can be performed easily. So you have to select this band, and today I'll be teaching you 1, 2 or 3 exercises with this band. So let us demonstrate one exercise called as reverse flies. Again, here you have to stand in a comfortable position, standing like this, holding the band, leaving some space in the center, and just lifting with the elbow straight to the level of your shoulders. Again, you have to stretch the band outward like this, rotating your hand out. So we'll call this as flexing your elbow at 90 degrees abducting your hands and externally rotating your shoulders. And during this process, you have to hold the breath. So one more time, I would like to demonstrate you simultaneously pulling and taking a deep breath in. I'm taking breath through your nose and leaving it through mouth. So here I am just extending my elbow, pulling it out, rotating my hands outwards. This will strengthen your intercostal muscles. So the muscles around responsible for your breathing. There's one more exercise called dynamic heart. This is useful for diaphragm, which is a prime muscle of respiration. You have to hold both the ends like this, wind it around your chest. Might be around your third or fourth rib. Just wind it like this, hold both the ends, and pull it as much as you can, and inhale air. And slowly exhale through mouth. So I'm leaving the band when I'm exhaling. Again, I'm giving resistance when I'm taking my breath and pulling the band so that I'm holding it for a couple of seconds as much as I can. Then exhaling out. So this will strengthen your diaphragm, which is the prime muscle. So strengthening part, I have told diaphragmatic strengthening through TheraBand. Next is through your intercostal muscles. Even these muscles are responsible for breathing. Now we need to focus even on accessories muscle. There are some accessory muscle called as Kamineni, etc., which are responsible for breathing. So you have to take the band again, hold it at two ends, keep it under your feet. And keeping it under the feet, you may not be able to see that, but just keep it under your feet, hold both the ends. I'll just come a little forward and shrug your shoulders. Here I'm holding the band, pulling my shoulders up, holding my breath, and slowly exhaling through mouth. Even this, I would recommend you to do a hold time of 10 seconds and repetition of 10. So all the exercises which I have taught you, the hold time is for 10 seconds and your repetitions would be 10. So we have finished our warming up part, doing like starting with gentle walking, then exercise with band, and then we have done our strengthening part. Strengthening part was like 3 we have discussed. One is to strengthen your diaphragm, it is called as dynamic heart. One is to strengthen your intercostal muscles, and one is to strengthen your accessory muscles. So we have finished our strengthening part with exercises on TheraBand. Now coming to lung drainage. So as this is this disease mainly involves lung and symptoms of cough, productive cough, you need to know some techniques wherein you can expel your sputum out. So I'll be teaching few techniques to expel your sputum out. You can even term this as drainage or lung clearance techniques. First one is coughing. Coughing is something blowing out forcefully air with closed glottis. Like this. Just you have to cough, and any sputum comes, you should attempt taking it out. Next is huffing. Huffing is nothing but blowing out air through mouth with open glottis. Like this. People who have cough, I would not recommend you to do huffing. So people who do not have cough, you have to start doing huffing. That triggers cough, and you can expel through the cough. You can expel the sputum out. There are some other devices called as expiratory devices, which triggers your trachea, and you can get a cough. So one of the devices I have today is called as acapella. You can see over the screen. It has a mouthpiece at one end, and at one end you have some resistance. You have one plus and minus marks here. Hope you can see this on the screen. So I would recommend you to start with the minus part, so that this indicates resistance. So there's a flutter inside which vibrates and causes cough. You have to keep this mouthpiece in the mouth, and spirometer was taking in air. Now we are blowing out air. And in case you're not getting cough, I would recommend you to rotate this knob to the positive side so that the resistance is increased. And with this resistance, a cough is triggered. And even here, you can expel your sputum out. So now we have known 2 or 3 techniques in clearing the lung. One is coughing, one is huffing, and one is expiratory device called as acapella. And another one, most important thing I would like to teach you is called as autogenic drainage. Autogenic drainage is something where you clear the secretions by yourself. There are two parts in this. One is assessment part and one is clearance part. Assessment part, you have to take both the hands, place it over your chest, either this way or this way. And just take a deep breath as much as you can and exhale air through mouth. By doing this, people who have secretions, you will find some crackling sounds in your lungs. You can palpate that or know with your hand that sounds vibrating. So when you take deep breath, initially you find these crackles that indicates that the sputum is somewhere in the midway. And during the end of expiration, you hear some crackles. That means that the secretions are somewhere in the periphery. So now you have known that you have assessed yourself that there are some secretions, and you have to know the clearance techniques. Here there are again three ways where you can clear. The first way is take a shallow breath, keeping your hands over the secretion part where you feel more and give light compression over that area. Take a shallow breath and blow out air as much as you can. So the secretion starts to move. Then the second way is, and the second part is take a little deeper breath than the shallow breath. And then exhale the air out as much as you can. Now the secretions which have started moving will come to the midway. And the final part is take a deep breath, compress your hands, exhale it with a cough, so that you can even compress the part where you have secretions. Here you are again mobilizing the secreted part. So you have learned these three techniques of lung clearance. One is through coughing, one is through huffing, one is using expiratory device, one termed as autogenic drainage. So finishing this warming up, finishing of the strengthening part, finishing of this lung clearance technique, you should know, you would be you have finished your exercise part. Now I have seen a question on the screen. Does exercise help in detoxifying the body? And yes or no, the audience can answer this question, and I'll give some time for that. Before that, I would explain one more part. Yeah. Now, having finishing all this, you'll be you're prone for muscle injury. So initially, as I told you, you have to finish your exercise with stretches. So I'll now teach you one or two stretches for your diaphragm and your intercostal muscle. Okay, let me answer this question. Does exercise help in detoxifying the body? Definitely yes. I would say exercise would help you to detoxify. So by doing exercises, whatever exercise it might be, either strengthening or cardiovascular exercise, there will be good amount of blood circulation in your body. Whatever the waste substance accumulated starts moving away. And by improving your blood supply, it detoxifies. You get new blood supply to the part. It might be either lung, liver, whatever, so that it rejuvenates again, getting fresh nutrients. Thus, it helps in detoxifying. So I'll teach you the stretching parts. You need to stand up. You can even do this if you in sitting if you cannot stand. So keep one hand flexed on your tummy and the other hand over your head, and bend to one side like this and take a deep breath. You feel a slight stretch over this part where the diaphragm is. One is by bending and one is by inhaling. Hold on for a couple of seconds, might be 4 or 5 seconds, and repeat 4 or 5 times. And again, you need to do the same thing on the opposite side, because your diaphragm is dome shaped, which has two sides. I'm just flexing my hand again, keeping on the elbow and stretching to the opposite side and taking a deep breath. So again, this side also you can do 2 or 3 repetitions, holding for a count of 20 or 30. And the last thing is for your intercostal muscle, just stand in a standing position, just turn this way and take a deep breath. So you're twisting your spine. By twisting your spine, the muscles around your rib are stretched. You can hold even this for a couple of seconds. Take a deep breath and exhale. Again, do for the opposite side. I'm taking a deep breath, holding, and then exhaling. So now we have finished our exercises followed by our stretching. We have one more poll question here. Do physical activity make healing more effective? This question is very interesting. Definitely, I would say that physical exercise would help in healing. You asked me why. See, healing process involves different phases, starting with inflammatory phase, we call it as. Inflammatory phase, you get all the substance, it's like fighting to take the disease part away or the bad substance from the part affected. So here again, the blood supply increases and gives more of blood supply to the injured or diseased part, for example, lung, and it rejuvenates the lung by giving more of blood supply, more of oxygen supply to the part diseased. So in that way, physical activity definitely helps in healing. So now we have completed various phases of exercises like stretching, strengthening, etc. And post-COVID patients feel more breathless and dyspneic, and they're a little weaker also. So by completing all these exercises, it might take you 10 or 15 minutes. Once you're done with these exercises, I would recommend you some relaxation positions. Relaxation positions might be either in lying or in sitting. Lying, I would recommend you to lie down in semi-lying posture. That is, this is 90 degrees and this is 45 degrees. So 45 degrees, this is the head end. So I would recommend your head end to be at 45 degrees like this. You can place some pillows under your bed so that you're reclined. You can even use a pillow called as wedge pillow, which is available in the market for that. So this allows less compression of your respiratory muscles so that you feel little relaxed. And if you're sitting, I would recommend you to just stoop a little forward, rest your hands on a surface, and just bend like this and take a relaxed breathing. So in that way, you are even relaxed for your respiratory muscles, breathing, everything. So now we have finished various parts in exercising and learned various relaxation techniques. Now we have another poll question. Here the question is goes like this: exercise turns fat into muscle. Yes or no? Yeah, this question, there is again a myth in this. By doing exercise, fat is converted into muscle. But definitely no. Fat cells are different and muscle cells are different. Fat, by doing exercise, you burn your fat cells. Thereby, the waste fat which is present, I'm not talking of the good fat, it's the waste fat reduces. So that your basic metabolism in the body increases. By doing this, yeah, considerably after some time, if you do some strengthening part, it also helps in developing your muscle strength. Now, let me discuss some various chest. All the discussion which I'm doing today is regarding chest physiotherapy because the prime organ involved in post-COVID patients would be lungs. Chest physiotherapy for various special need patients. So let me talk something about geriatric patients. Who are geriatric patients? Any patients above age 65, we will term them as geriatric patients. These patients can follow all the exercise regime which I have discussed now, and they might have some issues of balance and coordination. So they would not be comfortable doing this exercise in standing, and it will be a little tough for them. So patients like that, I would recommend them sitting. Another best thing for them is to do cycling. They can sit on a proper cycle and do exercising with the cycle as comfortable as they feel. And if you don't have any of these gadgets, even then you can exercise. That's just by singing aloud. This is one of the easiest things. The more you sing whatever song you know or whatever, just convert into a song, try singing aloud. By singing this, you strengthen your lungs definitely and your respiratory muscles also. So this is one technique for geriatric people or people who cannot have some balance issues. They can just, or who do not have any gadgets at home, to follow and do this exercise. Now let's talk something, chest physiotherapy for vulnerable patients. Who are vulnerable patients? Patients on dialysis, patients on chemo, or patients, immunocompromised patients, we term them as vulnerable patients. These kind of patients would have less immunity. Even after, suppose they are attacked with COVID, post-COVID, the recovery also would be little late, and they're again prone for any kind of infections. For them, these kind of exercises would encourage them to produce their endurance and other probabilities. So I would distinguish three sets of exercises which improves immunity in this kind of patients who are immunocompromised. One is strengthening exercise. You can do whatever exercise I've told you here. One is cardiovascular exercise that you can do either by walking or by doing cycling, or you can even do some exercises through spirometer that improves your endurance. So these three as a unit will try to improve your white blood cells in the body. White blood cells are which fights with the disease, and this will definitely, the more the cells, your immunity is increased. So these kind of patients doing these exercises would help them to develop their immunity. Now let's discuss something about disability. Chest physiotherapy for disabled patients. There are different kinds of neurological diseases or any other permanent disabilities through any other injuries. You might land up with COVID. Patients with these kind of problems may land up with COVID. So for them, you can do all these exercises and they should focus certain things. Normally, a breathing pattern while taking in, your abdomen protrudes and slowly comes back. So these kind of patients move their chest more than their abdomen. So they're using more of effort and they're using more of accessory muscles. So by standing in front of a mirror, I would recommend those patients to just concentrate on their stomach so that it bloats out and slowly exhale the air out. So these are different techniques for disabled people to do post-COVID exercises, especially for the chest muscles. Now, last but not the least, I would recommend for patients with NCDs. You know what the term NCDs are? NCDs are non-communicable diseases. Non-communicable diseases are like hypertension, diabetes, etc. Our chairman, Dr. Pratap Reddy, is more focused to have an India free of NCDs. That's non-communicable diseases. So we have designed a program called as prehabilitation. Yes, you have heard right. It's not rehabilitation, it's prehabilitation. Here we design various exercise programs in which it develops your immunity, strength, your muscle, your agility, all this. These people who are good also, people who do not have COVID also, and people who do not have any other disease can get enrolled in this kind of programs and they can participate. It's not like regular going to gym and working out. Here you are under supervised under medical professional. You assess thoroughly that you don't have any problem and you are designed with some exercises so that you land up correct without any injuries. So rehabilitation is again consists of strengthening program and cardiovascular exercises and developing your endurance exercises with various modes of our presentation. And these are the main things which I thought I would tell you today. And I think we have another poll question coming up. And these are the main things which a post-COVID person has to know. So by knowing all this, you will benefit a lot rather than just performing some exercises which you know in general or randomly. This is done under supervised. So we here at Apollo Your Life has customized our rehabilitation programs at various levels, at various age groups. So you're free to either follow our program. As I said initially, this drug called as exercise, my brand name called as physiotherapy, can be done either individually or under a supervised medical professional. So individually, if you want, you can follow our ads, you can follow our programs, and you can start doing those exercises yourself. And if you're more particular and if you feel more scientific, you need to walk into our rehabilitation centers and we would thoroughly assess you. And physical therapy is going to be a tailored process. It's not one-way process wherein I teach you and you keep doing. People might have various comorbidities where or various problems where you're not supposed to do few exercise and few exercises you're supposed to do. Patients come up to me telling that I do yoga and this benefits me like this. Yes, of course, yoga benefits you, but you have to know what to do and what not to do. By knowing this, definitely you will benefit. If you do not know what you shouldn't do and keep doing whatever yoga, tai chi, you might land up with a problem rather than solving yourself. So we here, customer at Apollo Your Life, customize our exercise programs and we design the exercises to you. And I think I've discussed almost all the topics which I've prepared, wanted to deliver you today. This post-COVID patients, mostly two, three factors we have to know is to strengthen your respiratory muscles, to strengthen your lung. These are the prime thing I wanted to focus. You can even concentrate on strengthening your muscles, etc. So people mostly after COVID complaints like we have joint pains, we have knee pains. Apart from your drug called as physiotherapy taken from the lungs, I would just emphasize little other systems too. So coming to musculoskeletal systems, people who land up especially with knee pains and all, I would recommend them to do some kind of exercises called as isometric exercises. These are just strengthening your muscles around your knees, and you have to follow some precautions by doing this also. And you need to reduce, if you're overweight, you concentrate on reducing your weight. And certain tips like squatting on the floor, climbing stairs, all this have to be reduced. So by taking some preventive measures like this, you are prone to have less injury and you will strengthen your muscles. So neurological problems, patients who has neurological patients post COVID, this might trigger more. So I would emphasize you to concentrate more on your neurological issue through physical therapy. That's called as neuro rehabilitation. Through neuro rehabilitation, you have to do little more vigorously than pre-COVID. So post-COVID, you concentrate first on your lungs, and suppose you are in a stroke-affected patient, you have to concentrate first on your lungs, thereby concentrate on strengthening your muscles and your coordination, your gait, name it, whatever is involved in your system through the exercise program. Okay, suppose few patients are living in remote areas away from the facility of physical therapy or rehabilitation. We would recommend you to come online and follow our rehabilitation programs which are aired online, so that definitely it will benefit you. So in this way, as a holistic approach, we here at Apollo concentrate on treating post-COVID-19 patients. Hope you have enjoyed my session on post-COVID-19 rehabilitation, and keep looking forward for more updates on post-COVID.